Infection, exposure to radiation, and improper use of medication are strictly prohibited during the pregnancy. Antibiotics, analgesic, hormones, and even vitamins and calcium supplement should be taken under extreme precaution. Imagine you're pregnant and caught a cold. Under ordinary circumstances, you probably have taken a drug, but being pregnant, there isn't much you can do. It's a common belief that pregnant women should avoid taking medication that can harm the fetus. But in Oriental medicine, pregnant women takes medication for various reasons. What makes this possible? We'll search for the answers in this episode. But this is not the case in Oriental medicine. Herbal medicine is given to the pregnant mother without much hesitation. In fact, pregnant mothers are highly recommended to take the medication to overcome the problems often associated with the pregnancy. What is the reason for the herbal prescription to be used more freely than the Western drugs? Herbal medicine is made of natural components in the original state, and the prescription is made according to the principles. So unlike the Western medicine, the effects of herbal medicine on the fetus is very minimal. Herbs are natural medicine, but you cannot rule out the possibilities of harming the fetus and the nursing mother. What's your opinion on this?
Herbal medicine contains natural constituents, so it's more gentle on the human body than synthetic drugs. But not all herbs can be used on pregnant women, especially herbs with toxicity. For simple treatments to promote digestion and to treat constipation, mild herbs are prescribed to reduce the chance of side effects.
Medication is known to affect the fetus most significantly between the 3rd and 8th week of pregnancy. This is the time of the formation for the visceral organs and other sensory organs. Thus, improper drug use can result in thoracic fetus, and taking the medication throughout the pregnancy can hinder the growth of fetus. Under these circumstances, a pregnant woman should approach the matter of taking a drug very cautiously.
Herbs normally given to the general public should be used with extreme precaution among pregnant women, because some herbs can be harmful to the fetus and cause enormous problems after birth, and even offers a chance of miscarriage. This herb is called Job's tear seeds. It is a diuretic herb with a strong draining property. Taking this herb in the early stage of pregnancy may yield miscarriage, and during later stages it may cause an insufficiency of amniotic fluid. Cinnamon bark has warming properties. Thus, taking this herb during pregnancy can raise the temperature of the fetus's skin. This herb is aconite. It is very toxic and must be given by prescription even to the general public, and should never be given to pregnant mothers.
Herbal medicine should be used under strict provision, and this applies at a stronger degree for the nursing mothers. Let's see how herbal medicine is used for the symptoms during the pregnancy. Morning sickness that shows up in the pregnancy between the 2nd month and 4th month can be relieved by an herbal medicine with up to 80% effectiveness. With morning sickness, a pregnant mother can take enough nutrition because of nausea and vomiting when encountered with the food. Oriental medicine explains morning sickness is from the heat generated from the pregnancy, so cool herbs like bamboo shavings and cypress root are prescribed to clear the heat. But with severe cases of morning sickness, even the herbal extract can't be swallowed. In this case, instead of trying to drink the extract, hold the extract in the mouth and slowly pass the extract downward. After a few attempts, the extract will be easily swallowed and morning sickness diminishes.
왜냐면 남자분들은 약을 먹으라 그러면 술을 못 마시니까. 네.
Tooth pain is another problem that only Oriental medicine can treat during the pregnancy because the Western analgesic drugs are fatal to the fetal health and growth. Oriental medicine treats toothache by gargling the herbal extract. Angelica root and wolfberry root are boiled in a water, and the extract is used as a gargle to suppress toothache. Angelica root reduces pain, and wolfberry root treats infection from the body heat. After gargling a few times, toothache is alleviated without internally taking the drugs.
Pregnant women have a tendency to neglect diseases, worrying that medication may harm the fetus. Oriental medicine determines whether the disease of a mother affects the fetus or vice versa before deciding on the treatment. These treatments and herbal prescriptions are given under the consideration of calming the fetus. Thus, a pregnant woman can receive the treatment with confidence.
There is a herbal prescription to smoothen the delivery. The name of prescription is Bursosan, literally means Buddha's hand. The name suggests how effective this prescription is. Angelica sinensis and Ligustici root are the major ingredients, and these herbs tonify the blood and induce easier delivery. When preparing this prescription, a cup of rice wine is added. Prepare the extract in advance and drink a cup when the labor starts, and drink another cup when the labor speeds up. Medications that benefit others may be harmful to pregnant women. This rule is also applied to herbal medicine, as the number of herbs are prohibited during the pregnancy. Thus, herbs prescribed during the pregnancy must protect the mother and fetus while treating the disease. But if a mother is incompetent about taking the drug, it is wise not to force it. Thank you for joining us today.